So these past few weeks of being a surgical resident have been filled with firsts. My first surgery, my first time a patient vomited on me, stuff like that. Recently I had a first that was a lot more profound than vomit. There was a patient on our service who was not incredibly sick, but elderly, certainly over 90 years old. It was decided between us and the family that we were not going to be aggressive with her care. We were going to make her comfortable and we were going to treat her conservatively, but we weren't going to do any heroic measures, meaning we weren't going to perform surgery, we weren't going to do anything risky or painful. Shortly after rounds, it was clear that her heart was failing. She was having arrhythmias, she wasn't breathing properly, she just didn't look like she was long for this world. Called the family, let them know, and soon after, her heart stopped. She was on the monitor, so it was really easy to see. The rhythms and blips just went from to... You guys have all seen that on TV. So we went and did an EKG, which basically tells us what the heart's electrical activity is, and there was none. Waited a few minutes, did it again. Again, there was nothing. Patient was peaceful, was comfortable, and died. The family arrived a few minutes later. I had the job of telling them exactly what happened, and of course they were sad, but they were comfortable with how everything went. Patient didn't die in distress, didn't die with a tube in their mouth, or in surgery, or something like that. The family did some religious rituals which were really quite moving, and then I left them to say their goodbyes. I went down to medical records or admitting, I don't even remember where it was, some office deep in the bowels of the hospital. I had to put my name on a document that said that the patient had died at a specific time, of specific causes, and they even took my fingerprint to make it official. To be frank, I hadn't really met the patient, but I'm on her death certificate. The whole thing went as well as something like that can go. Most people don't want to die in the hospital, but if they have to, they want to die on their own terms, be it with aggressive care or not. The family and the patient weren't surprised that things were going this way. The patient's wishes were honored, and the family was there, if not at the moment of death, right afterwards. And I'm not going to say it was a positive experience. Death is hard, even when it's expected and not traumatic. But I guess I feel lucky that the first death that I don't know what the word is, managed? The first death that I was the first death of one of my patients went as well as that. I'm a little conflicted because in medicine, often our attitude is that disease and death are the enemy, and we're at a battle against them. But that's not really true. I mean, disease and death are a part of life. We want to make the patients healthy and comfortable. I think our goal should be to make them happy. And if making them happy means making them comfortable while they succumb to their terminal illness, then that's appropriate. Fighting to the bitter end when it makes the patients less comfortable and doesn't improve their chances of survival, especially if that's not what they want, is to me the antipathy of what a doctor is supposed to do. And I'm glad that I was able to see that through, to see that theory in action, to see that this patient and this family really got what they wanted in this patient's death. They didn't want her to die, but they wanted her to die with dignity. And that's really what's most important, to retain dignity. I'm sure I'll see many more patients die. I've already seen a few people pass. But this one was different, I think, because I made it official. I signed the documents. I was there. Everybody's seen on TV, right? I'm calling it, and they say the time of death. I did that. I declared the patient dead. Such a responsibility, I mean, obviously it's a huge part of the person's life. It's the end of their life. Just really struck by it. And every few days I experience something that makes me really feel like a doctor. I make a decision that isn't easy and has an impact on somebody's life. I suture somebody up. I discover a diagnosis that other people miss. I get puked on. I hold a hand. I make somebody feel better when they're crying. Um, I guess this was one of those times where I felt like, okay, this is what being a physician is about. It's walking people and families through their own death. So I guess I'm closer to being a doctor. Baby steps.